Hi, it's Debbie Seidel-Bidkey, founder of dentalpracticesolutions.com, and I'm back this week because I want to bring everything together. You see, for the last 6-8 weeks, we've been talking about value-add propositions, why your patients are going to accept, pay for treatment, and keep coming back for the routine hygiene appointments. And I want to break it down today. I've given you a handout, and you can actually grab that handout and follow along, maybe have a team meeting. So we're going to actually work today with what is the patient's condition, what are the values, understanding what's valuable to that patient and breaking it down into words they understand. For example, if you remember from a few weeks ago, we talked about words like active disease, bleeding gums, things like this. You're going to understand what's valuable and use those words that they understand, and then what are the benefits for that patient progressing through the treatment plan and returning for future appointments. So grab the handout below, and I'm going to walk you through this right now. They say that practice makes perfect, and I want to encourage you to use the ebook that you've received and have a team meeting. Schedule that for about 2 hours and meet as a team, including doctor. Inside the ebook, you have an example, and I want you to pull 2 or 3 of your patient charts, or use the electronic charts if that's what you have. You don't use paper charts anymore probably. But use these 2 or 3 patients who have been rather challenging to get them to yes for their treatment, and sit down and talk about some of these things that are on this form in your ebook. It's a little template, and you write the patient's name, their age, their occupation. That has a lot to do with their personality and what you can say to create a yes from them. You're going to write down their conditions, oral and systemic. John Jones has high blood pressure, gum disease. I imagine that he has active disease, but it's not where he has periodontal disease with bone loss. He also has some concerns. He doesn't like to spend money. So some of the words that will add value to John so that he will schedule his appointment is talking about active disease. That means something to him. He doesn't want disease. And bleeding gums. The word inflammation. Inflammation in the mouth relates to inflammation in the body. And inflammation in the body creates high blood pressure and other diseases as well. Now, by having preventive care versus coming in to treat disease, you're going to save money. This is a conversation that you want to have with somebody like John, that he wants to come in for routine preventive care, so he's not spending a lot of money treating the disease. And this is going to improve his overall health. So now he's not going to be spending a lot of money. God forbid that he had cancer or a surgical procedure because of the high blood pressure, heart disease, and other health problems that came to be because of the high blood pressure. So just some suggestions for you to sit down and talk about these and role play with your team. Words that add a lot of value to why your patients return are called value propositions. It's used as a marketing term. It's a promise of value to be delivered to your patients. It's the primary reason why they're going to schedule and pay for treatment, as well as return for their routine hygiene appointments and refer their family and friends. Pictures paint 1,000 words, so use pictures, brochures, posters. If you don't have the intraoral camera available, if you do, if it's the auxiliary or the hygienist, always have those pictures up on the computer screen to show doctor, and use those value add words when you're showing the patient what you see in their mouth. Look at these right here. I mean, you can see this big gaping hole over here, and hopefully, some patients might not even think that's abnormal, unfortunately, but showing that to them and saying, there's a big hole in your mouth. It's not supposed to be like this. Showing them the little crack here that leads to a tooth that breaks off right here, and showing them that, and the discoloration and these ragged fillings right here, and looks like some possibly some occlusal wear. I'm not sure if that's wear or just some staining there on that tooth. My husband had some brown spots. These are not his teeth, and the brown spots didn't go into these deep pits right here. But he saw the brown spots, had never had any decay, and he wanted those brown spots removed. So showing him these spots, who wants those spots on their teeth? And you can start to see the deeper pits and fissures in these teeth here. Look at this. This could be John Jones over here. Hope not. John Jones, in my mind, did not have chronic periodontitis. But look at the spaces, and sharing with the patient that these spaces here cause the teeth to be loose. People are going to understand that word. And then what are these crystallized deposits of plaque? Plaque that's hardened. I'm sure John Jones understands that. If we're telling John Jones that there's bulbous papilla here, I don't think he's going to understand that. But when we start to talk about inflammation and redness and bleeding, even maybe some pus here, I know John Jones is definitely going to understand that. And then once the patients understand and value what's going on, the benefits to them, what's in it for me, that's when you talk about the benefits. To John Jones, the benefit means that there's not inflammation in his mouth if he proceeds with treatment, and he's less likely to have inflammation in his body, which is going to exacerbate the high blood pressure and can lead to other systemic diseases. John Jones coming in for preventive care is going to eliminate the cost of coming in to treat disease and other medical problems as well. With his, high blood pressure can lead to other diseases, which could cause him to have a hospital stay. Also, proxemics. It's a subliminal type of communication, but notice doctors looking into the patient's eyes. Notice the distance between them. It's just a perfect distance, not too close, not too far away, and they're knee to knee, eye to eye. And if doctor needs to refer to some x-rays or show something on the computer screen, it's right there in front of the patient. So words mean a lot. But also the posture and the way that you say your words are probably over 50% of the conversation. I hope you found working through the patient, their values and benefits, has been helpful for you. To implement this and get it going, it's really important to get all of the team members on board. And in fact, this can help you with enrolling many of your patients with those treatment plans. So plan to print out this form that I've created for you today. Get together as a team and have everybody maybe bring a chart for a patient that they're having some challenges with, and work through this together as a team, because a team-driven dental practice, that's the type of practice that's going to be the best of the best. And be sure to follow me for next week's video. Thanks for joining me.